Welcome to the data training webinar Path 204, Modeling with Population Assessment of Tobacco and Health, or PATH Study Data, Mediation and Moderation Effect. This webinar will be led by Westat statisticians Dr. Jean Opsomer and Dr. Xiaoshu Zhu. A link to a transcript that includes descriptions of all complex images and information is available in the YouTube video description. Disclaimer: this is not a formal dissemination of information, and the views and opinions expressed in this presentation are those of the authors only and do not necessarily represent the views, official policy, or positions of the U.S. Department of Health and Human Services or any of its affiliated institutions or agencies. This webinar is intended to be introductory because mediation and moderation analyses are advanced analytic methods and can be very complicated. For this training webinar, we will introduce causal modeling, discuss the basic concept of mediation and moderation analyses, and will show you how to run these analyses using path study data. Finally, we will discuss the issue of confounding variables. Please note that the examples and estimates provided in this presentation are to aid researchers in their analysis of path study data, but do not represent an endorsement of any particular analytic method or official estimates. We will start by discussing causal modeling generally. We'll then talk about moderating and mediating factors broadly, and then go into each one of them in more detail. When we talk about mediator or moderator analysis, what we're really talking about is causal inference. We're not just looking for correlations, but trying to understand if a certain exposure, E, causes a specific outcome, O, of interest. This is our causal mechanism. We have a hypothesis or a conceptual model that postulates that this exposure causes this outcome. Unless you're doing a randomized experiment, you have to account for other factors that can affect your outcome aside from how E impacts O. These other factors should be part of your conceptual model if you want to obtain a correct inference. What we'll discuss in this webinar is two types of factors: moderating factors and mediating factors. At the end, we'll comment on confounding variables as well. Here we have our first complex causal mechanism, moderation. A moderating factor or variable, A, is basically a variable that modifies the effect of the exposure on the outcome. In other words, for different values of A, the moderator, the relationship between E, the exposure, and O, the outcome, changes. If you don't account for that and just look at the relationship between exposure and outcome, you will still most likely see an effect, but the effect E has on O is conditioned on the observed value of A. We'll talk about that later, but it's basically averaging over what happens with A. It's not as if you don't see an effect, but you just don't know as much about the effect because the impact of A is ignored. The next causal mechanism, mediation, is different. It's also a variable, the mediating variable B, that's in between the exposure E and outcome O, but in a different way because it's part of the causal pathway. You can have different versions of this. You can have the exposure affecting the outcome either directly, only through the mediator, or through both. This matters because if you're ignoring the mediator B and just looking at the exposure and outcome, you're missing explanatory information of what happens between the two. You can tell that E causes O, but you aren't able to understand how and how much is influenced by those different pathways. For both moderation and mediation, if you ignore these factors, it's not as if your analysis is completely incorrect. You're just missing some of what's happening. You're essentially ignoring the effect of the moderator or mediator on the relationship you're trying to observe. In other words, the observed effect cannot be decomposed into direct and indirect mediated effects. People will often express causal models with a diagram or a directed graph that goes through mediating or moderating effects. But if you are going to do a data analysis, you have to write down a statistical model that corresponds to this diagram and lets you estimate the effect. Hence, the statistical model becomes a way to estimate causal effects. It's critical that you put in those potential effects because you might not necessarily know whether what you say is a mediator is truly a mediator. You need to put mediating and/or moderating variables in the model so you can estimate them. In particular, you should write your model in such a way that you have parameters that you can estimate that will tell you whether those effects are present, the direction of the relationship, and how much it is impacting the outcome. The problem is that you usually can't go backwards, meaning you can't use statistical analysis to tell you whether something is a mediator or a moderator. The statistical analysis will tell you about the effects, but can't tell you whether they're really causal or how they work. That's important to realize. You need to start from the conceptual model, add in those effects, and then you can estimate whether the effects are present or not. But you cannot use the model analysis to tell whether something is a mediator or a moderator unless you have specified them a priori in your model. In this webinar, we will provide an example of how to specify a model. Our example uses a cross-sectional regression with an interaction term. While not equivalent to causal modeling, it can be a way to represent a causal effect in a model. As a side note, I want to add a quick disclaimer about what we are doing here. Mediator and moderator analysis are an important but somewhat narrow corner of the much broader research field of causal inference. There are many other statistical tools that are useful in causal inference that we are completely ignoring here. Let's go through moderation in more detail, then we'll do an example. Afterwards, we'll go through mediators and do an example using path study data. This is the same moderation diagram as before. This moderator variable, or effect modifying variable, is specified because it can affect the presence, direction, or strength of the relationship that you're interested in between the exposure and the outcome. As stated before, the reason why it's a moderator is because for different values of A, the effect of the exposure on the outcome can be different. The reason we add moderator variables to our causal models is because it allows us to understand the causal effect on subpopulations. Who has most effect, who has less effect. In particular, this allows us to identify groups who could be at higher risk, which is critical in many analyses. By having a model that accounts for differential effects for subgroups, we end up with a model that fits the data better, so that the effect estimates are more precise. Finally, a model that accounts for the effect on subgroups can make it easier to compare results with those of other studies by identifying the limitation on when the relationship between variables holds. Here we'll highlight some pitfalls to be aware of. If there is a moderator and you ignore it, it's not as if your analysis is completely incorrect. What happens is that your estimates of the relationship between exposure risk factors and the outcome is conditioned on the values of the moderator. You miss the opportunity to understand the dynamics of the relationship that are based on subgroup characteristics. Another way to say this is to say that if you ignore the moderator, the estimate you get is really an average over all the possible values of this moderator in your dataset. You still get an estimate, which we're calling a crude estimate. It's not an incorrect estimate, it's just a weighted average of potentially more interesting estimates by group or by stratum. If you don't account for them, you don't have a biased estimate, you just miss the opportunity to better understand the relationship. The last point here is important. If you ignore the moderator and you're only estimating this crude effect, it's difficult to do prediction. For instance, if sex is an important moderator of an effect, and I ask you to predict the outcome for a male, you might not get a good estimate for that prediction because you don't know how the effect differs for males versus females. What should you do? If you think there are possible moderators for the relationship between exposure and outcome, then you should make sure you include them when you're designing your study. In other words, you should account for the different values of this moderator so that you can observe the different groups and obtain estimates at the group level with a large enough sample size. Then you need to collect the data that lets you do this. Because if you think of a moderator, but you don't collect the data on that construct, you can never adjust for it. There are two main ways to account for the modifiers in the analysis. First, suppose you suspect a variable is a potential moderator, and this variable is categorical with a set of strata. Then I'm going to do a separate analysis in every stratum and compare the estimates of the risk of the outcome. Conceptually, that's probably the simplest way to do this, to just split up your dataset, do separate analyses, and look at the results. The second way is to write a model for everything, but account for both the exposure and the moderator in that single model. You do that by adding an interaction term. Both methods get you to the same place, but the second method, as we're going to show you, makes it a little easier to interpret the whole model at the same time rather than just by groups.
Here, we selected a simple example using past study data to demonstrate moderation effects. A previous study found a positive association between smoking status and loose teeth. For our model, we are considering age as the moderator, which can modify the relationship between smoking status and loose teeth. The predictor, or the exposure variable we are interested in, is current established cigarette use status. The outcome is whether people had a loose tooth in the past 12 months, and the moderator is the age of the person.
As I mentioned before, with moderators, there are two types of analysis, and we'll go through both. For the first one, which I think is the more traditional one, we'll do separate models by stratum and then compare the results. The goal is to assess whether the effect of exposure is different in groups of people with different characteristics. This is primarily for categorical moderation effects. If we fit it for every group and determine somehow that the effect is the same, then there is no moderation. You would call this exposure effect homogeneous. It's homogeneous because it doesn't change by stratum. If the effect is different by or for different levels of the moderator, you'd call it heterogeneous. A variable is a moderator if the exposure is heterogeneous. The stratum-specific measures are different from each other, and the crude measure lies between them. If it's homogeneous, that means there's no moderation. One problem is that there is no standard definition for when the difference in the stratum-specific measures is small enough that you call it homogeneous, and when it is large enough, you say it's heterogeneous, and therefore that it's a moderator. That's why the interaction approach might work better if you want to test the difference. If you do use separate models for each stratum, you need to report your results by stratum. The second method is using an interaction. Instead of performing stratum-specific separate analyses, you write out a model for all of your data, but include moderation as an interaction effect between E and A. Again, you parameterize it so that you can estimate the direction and the magnitude of that interaction. A model with an interaction term is not causal modeling in and of itself, but it can be a way to represent a causal effect on a model, as we are doing here. We will now go through the example.
We will only use variables from the Wave 5 path. Here you can see we are using current established cigarette use status as the predictor. For the outcome, we are interested in people with loose teeth in the past 12 months. For the moderator, it's a 6-category age variable. We are using Wave 5 single wave weights for the Wave 4 cohort for this particular example. Before we run any model, the first thing we should do is evaluate whether there is any variation in the outcome across levels of the moderator variable. You can see on this slide, the plot on the left just presents the overall main effect of this predictor, which is whether the two currently established cigarette use groups show a difference in the percentage of people who have loose teeth. Here it shows people who smoke cigarettes have a higher percentage of loose teeth. The dashed black line here represents the overall percentages in our sample. The plot on the right represents the distributions by the 6 age categories. If age is moderating the relationship between smoking status and loose teeth, we would expect the difference between percentages with loose teeth in the two cigarette use groups to vary across the 6 age categories. Here we see that for the younger age groups, 18 to 24 and 25 to 34, the percentage differences are smaller than the older age groups. The age group 45 to 54 has the largest percentage difference between people who currently use or do not use cigarettes. Please note that all percentages are weighted using the single wave weights. We observe that the distribution varies across age groups, but we don't know whether these variations are significant or not. We will get into the modeling part next. Let's first look at the approach that is stratified by the moderator. what you need to do is run separate models for each age category. How do we do that? We will use the domain statement within the survey logistic procedure. You can see here, for the model setup, we have our outcome and the predictors, and the way we run each model for each age category. In the SAS output, the first output will report the overall estimation. That is telling us that overall, there is a significant mean effect from our predictor. Let's remember the number, 0.52. This is the log odds difference of having loose teeth between the group who uses cigarettes and the group who does not. Continuing with the rest of the results from the code on the previous slide, we will now report the estimate by each of the 6 age categories. If we just focus on the coefficient for the cigarette use variable, you can see the value of the estimates varies across the categories and are definitely different from 0.52. The overall estimate for the youngest age group, it has the largest estimate or group difference in terms of log odds of having the loose teeth issue, and the smallest group difference is among the age group of 55 to 64 years old. But again, there is no statistical test to tell us if those group differences are significantly different than one another. Let's do the second approach, which is adding an interaction to our model and rerunning the proc survey logistic procedure. Here is that interaction, and we would like to evaluate if this interaction is significant or not. In this selected output, the joint test shows the main effects of the main predictor and the main effect of the age group. However, the interaction term between these two is not significant after our check. This is to say the effect of current cigarette use is not statistically different across age groups. These are the estimates of regression coefficients. Here we see none of the interactions are significant. The p-values are all larger than 0.05. Even though we saw the varying percentages difference between people currently using or not using cigarettes across age categories in the previous slide, the model result says differently.
This was kind of a negative example, but I think it's important to think about because we saw in the plots that things did seem to vary by age group. However, the relationship between the exposure and the outcome didn't vary by group because the interaction was not significant. One of the issues in this moderating type analysis is when you fit your model. Suppose you have included variable A, which is thought to be a moderator in your model. Is this truly a moderator, or is it in fact a joint exposure? Remember what we were fitting here. We were looking at whether smoking causes loose teeth and whether that changes by age category. We modeled that as an interaction in a regression. But something else could have happened. Age, which we thought of as a moderator, could also be thought of as a joint exposure, E star. In other words, you have two factors that can cause loose teeth. Age by itself, the older you are, the more likely you are to have loose teeth, and then tobacco use by itself. The more tobacco you use, the more likely you'll have loose teeth. So E and the additional E star variable both cause O, with the joint effect of E and E star inducing an interaction. With two possible exposures, how would you model this? Well, you would write it down as an interaction model and you would fit it. In that case, you will do the same statistical model because both conceptual models lead to this, but you have to interpret it differently. We had age as a main effect, right? Because age was highly significant. Tobacco use was highly significant. The interaction was not significant. That is what happens if you have a joint exposure that is additive or synergistic. But if a joint exposure is non-additive, antagonistic. This will most often result in a significant interaction. In a model where you have a moderator that is significant, you will also have a significant interaction. Statistically, you can't tell whether something is a moderator or a joint exposure. That's something you have to decide upfront when you write down the model, whether it's one or the other. In this case, because we had a significant main effect and insignificant interaction effect, it looks like joint exposure rather than moderation. But we didn't know that when we started. Thinking about those models when you have them is critical after the fact. When you set up a conceptual model, you get an answer, but it's possible that a different conceptual model might give you a similar answer. The point here was to show that only fitting the model and looking at the parameters will tell you whether something is significant or not, but it will not necessarily tell you the causal mechanism. It's often difficult to figure out whether something is a moderator or joint exposure. This is a caveat when you do this type of analysis. It's really important to realize that you can't tease those two things apart when you set up the model, and even after you fit it, you might not necessarily know. In other words, if this interaction had been significant, then we wouldn't know whether it's a moderator or joint exposure. It could be either one if it was significant, and then it's up to an analyst or the scientist to decide how to interpret it. Now let's talk about mediation, which is quite different in terms of how it works. We start with an exposure E and an outcome O, and we have a third variable that we're going to call B, which is the mediator. Unlike the previous case, where the third variable was something that could modify the relationship between the two variables, this variable is part of the causal pathway. In other words, the exposure is predictive of B, the mediator, and then the mediator is predictive of O, the outcome. We didn't have that in the previous example because we didn't say whether the exposure had anything to do with the moderator. But here we have this arrow that goes from E to B, which is critical for this to be mediation. This mediator can either take the whole effect between E and O or only part of the effect. The reason for this is that mediation analysis disentangles the different pathways and how important they are. If the mediator B fully explains the relationship between E, the exposure, and O, the outcome, that's called full mediation. In other words, there is nothing happening on O if B wasn't in between the two. A more common case is partial mediation, where there's a statistical relationship between the exposure and the outcome, even when B is taken out of the model or held fixed. But some of that effect goes to B and some of it does not. So B only partially explains the model. When would you want to control for a mediator? You want to take a mediator into account to understand the pathways of the causal mechanism or to explore the mechanisms by which the exposure influences the outcome. Sometimes it's also because you might have this pathway through B that you're not interested in, so you want to condition on that to remove the effect from what you're really trying to measure, which is the direct effect of E on O. In essence, to block a nuisance pathway in order to evaluate the strength of a pathway of greater theoretical interest. The proper treatment of these variables is required for the mediation analysis to be valid. Just like the moderator analysis, if you think this happens, then you have to account for mediation in the design phase to make sure that you record all those critical covariates and have enough variability between them that you're able to fit the model that can then separate those different pathways. We're going to do an example that's somewhat similar to the previous one, and this is whether a dental visit is a mediator on the effect between smoking and oral health, based off of several studies that have reported an association between smoking and poor oral health. This can be thought of as a mediator if two things happen. The first is that being a person who smokes has an effect on dental visits. So you have to have the arrow that goes from current established smoking status, the predictor or exposure, to dental visit. Because if smoking status isn't predictive of the dental visit, it can't be mediation. The second is that the dental visit has to have an effect on overall oral health, your outcome. Both of these need to be present for this to be mediation. Then if there's also a direct effect, then you would also have an arrow between the exposure and the outcome. Before we go through the example, we will discuss the components of mediation a bit more. Mediation examines how much exposure affects an outcome operated through a mediator, and it can be broken down into 3 components: total, direct, and indirect effects. We're trying to separate the direct and indirect effects, and we're only going to have one mediator for simplicity. The difference between the two is that the direct effect is that of the exposure on the outcome not explained by the mediator. In other words, it goes around the mediator. The indirect effect is the opposite and can be described as going through the mediator. If you're trying to measure the total effect, that's the simplest and can be done ignoring the mediator. But you might be interested in trying to measure the direct effect and the indirect effect separately. If you can do that, that really gives you a much better understanding of what you're studying in order to make policies or to figure out how to really make a change. This makes mediation analysis a powerful tool in public health and clinical research because it shows how and why an exposure exerts its effect on an outcome. One way to measure mediation, which we will call the traditional approach, is conceptually attractive, but we won't be able to use it for this example because it only works for linear regression. If you're doing logistic regression, like we are for the oral health example, it doesn't work. In principle, let's think of linear regression for a moment. Say you want to measure the total effect. You simply do a regression of the outcome on the exposure, not controlling for the mediator, and that slope parameter will give you the total effect. Then you can also estimate the direct effect by again fitting a model, this time with a mediator in it, and then measure how much change there is in the outcome for a change in the exposure. Once you have estimated the total effect and the direct effect, you can subtract to obtain the indirect effect. Like I said, that won't work here because we're doing logistic regression, where we can still estimate effects, but they are not additive like in the linear case. More complicated approaches not covered here can deal with multiple pathways, joint exposure, and so on.
We are still going to use the wave 5 path for our mediator example. The predictor is still current established cigarette use status, and the outcome is the 5 levels of how people rate their current oral health, which we have recoded to a binary variable. We combined the first 3 levels to be the good condition and the last 2 to the poor condition. 1 means they feel good about their oral health. The mediator is whether they had a dental visit in the past 12 months. The weights are still the single wave weights for the wave 4 cohort. We first examine the distribution overall and by the mediator. The graph on the left shows that for people who didn't use cigarettes, a higher percentage of them feel good about their oral health in general than the people who are currently using cigarettes. The dashed lines is still the overall percentages reported. The plot on the right separates or stratifies this overall distribution by dental visits in the past 12 months. You will see that for people who had a dental visit in the past 12 months, a higher proportion of them had good oral health than the people who didn't have a dental visit in the past 12 months, even if they smoked cigarettes. We definitely see some differences across the levels of this mediator. Even though the 3-step approach Dr. Opstremer just explained doesn't fully work for logistic regression, here we would like to walk through the steps to show how the effect or regression coefficient of the predictor is affected by the presence of a mediator in the model. Let's first look at the total effect coming from our predictor to our outcome with the survey logistic procedure. In this first model, we specify our outcome and the predictor alone. The estimation shows us the predictor has the significant association with the outcome, and that association is negative 0.60. In the second model, we would like to examine whether the mediator also has an effect on the outcome with the presence of the predictor through regression. Again, with the survey logistic procedure, you can see from the output table that both the predictor and the mediator are significantly associated with our outcome. But interestingly, this time the direct effect coming from the predictor changed after we added the mediator to the model. This shows that the mediator modifies the predictor's effect on the outcome. Lastly, we examine whether the predictor has a strong association with our mediator. Without this step, you don't know if the mediator is really a mediator or just a case of joint exposure effects, as previously discussed. This model shows that once we regress the mediator onto the predictor, we observed a significant effect or association between these two variables, which is minus 0.54. The three models together show that there is the mediation effect coming from dental visits to the relationship between smoking status and general oral health status. That is our evaluation of the effect of this mediation.
Earlier, I mentioned the idea of subtraction to determine the direct and indirect effect, and it's really tempting to say the total effect is minus 0.6, the direct effect is minus 0.47, so therefore the indirect effect is minus 0.13. That would be true if this was linear regression, but with logistic regression it's not true. All you can tell is that the direct effect goes down from 0.6 to 0.47, and there is another effect going through the mediator, so you can describe how things account for that other pathway, but it's not additive in this context. I have a few brief points to mention about the big thing that's lurking underneath these analyses that's important to be aware of. This is the issue of confounding. A confounder is another variable that I'm going to call C that can have an impact on this causal pathway in different ways. It can impact the exposure, it can impact the outcome, and it can jointly impact both of them. As a result, C can be a nuisance variable. If you have such a variable and you do an analysis where you put it in as a factor, it can look like a mediating or a moderating variable, or it can mask the effect of the true mediating or moderating variables. Confounders can really wreak havoc in your analysis. When you look in the literature, most results for methods that have been developed say, we are assuming there is no confounding present. If there's no confounding present, then you obtain all those nice results of being able to detect the mediator, the moderator, etc. Confounding can fundamentally change what you're looking at. It's absolutely critical that when you start an analysis or design a study that you think of potential confounders, using subject matter knowledge and information about the dataset, and then measure them, so that then, when you specify your models, you're able to account for those confounders. The way to do that is kind of the same as what we've done before, which is if you are aware of a particular variable as a confounder, you put it in the model with a parameter and then estimate it. Then either test for their effect or control for them as covariates. If you do this and it turns out that it's not a confounder because it doesn't appear in your final model, good. You've taken care of it. If it does appear and you can't get rid of it, it's a significant effect. That's okay because your result can account for it by conditioning. So you have estimated the effect of this variable, and now you need to determine whether it is a confounder or possibly a mediator or moderator, which will require subject matter knowledge about your scientific question. The only time you get a real problem with confounding is if you do not include it in your model at all. In that case, it will affect your analysis but be invisible in the results, so they can be biased. If you suspect some variables to be confounders, in addition to your moderators and mediators of interest, you can add additional variables for potential confounders to your previous mediation model or moderation model so that you are correcting for them. There is no solution that says, if you do it this way, then you won't have any confounding problem. You have to think ahead to which variables could be confounders and then make sure you build them in the model as you're working with it. This may sound a bit negative because it's a potentially big problem with no obvious solution. However, we are just making you aware that this can be present, so you have to think about it when you set up your causal networks with your variables. Thank you for attending this data training webinar. If you have any questions, please send them to the Path Study Data User Question email account, pathdatauserquestions@westat.com. Funding. This presentation is supported with federal funds from the National Institute on Drug Abuse, NIDA, National Institute of Health, NIH, and the Center for Tobacco Products, CTP, Food and Drug Administration, FDA, Department of Health and Human Services, under contract to Westat, contract numbers HHSN 271-2011-00027C and HHSN 271-2016-00001C, and the collaboration between NIDA and the National Cancer Institute, the National Institute on Minority Health and Health Disparities, the National Heart, Lung and Blood Institute, the National Institute on Alcohol Abuse and Alcoholism, the National Institute of Environmental Health Sciences, the Office of Behavioral and Social Sciences Research, the Office of Disease Prevention, the National Institute of Diabetes and Digestive and Kidney Diseases, and the National Library of Medicine, and through an interagency agreement between NIH NIDA and FDA CTP.